Hello, and welcome to another one of Montoux's video series with our focus this time on social determinants of health, the relevance as you age and how examining risk through the lens of social determinants can be beneficial for long-term care insurance providers. I'm Doug Nussman, head of sales for Montoux in North America, and Montoux is the decision science platform for life and health insurers. What we do is bridge the gap between the data and the people that make the decisions. I'm pleased to have Mike Hughes with me for this chat, and Mike operates a consultancy in Washington, D.C. area called Mitchell Lowy, LLC. Am I right, Mike?
Yep, that's it.
All right, perfect. Well, they center on the intersection of aging, technology, and health. And Mike has spent a lot of time through past roles at AARP and as an executive in the home care industry looking at trends in aging, particularly systems and supports that support long-term aging at home. And he's a subject matter expert on the topic of microsocial determinants of health. Am I right, Mike?
Yep, you're right on that too.
All right, good. Well, welcome, Mike, and let's dive into it. We're going to start with the introduction to microsocial determinants of health. And why don't you just give us an idea of what that is?
Yeah, sure. Yeah, well, social determinants of health are all of the non-medical or non-clinical factors that influence your overall health and well-being. And it can be anything from the state of your community to the state of your home.
That's great. And why is that important?
Well, because they really have a huge influence on how healthy and active you are, particularly as you age. In fact, it's estimated that clinical healthcare, your doctor visits, prescriptions, all that stuff, only influences about 10% of your health. Genetics counts for another 20%. Social determinants are thought to influence about 70% of your health outcomes and your wellness.
So that's interesting. How are those social determinants categorized?
Generally, I like to categorize them in macro and micro terms. So macro social determinants are the things that are measured by their impact on overall patient populations. So think of things like poverty levels in a community, rural versus urban settings, access to transport, quality of education and healthcare, things like that. Micro level things are things that are measured by their impact on individual people. And yes, the macro stuff applies, but think about things that are more variable and personal to you, like the state of your own home, your ability to do day-to-day tasks, your family relationships, your mental health, and your ability to understand and manage any chronic conditions you may have. I guess another way to think about this is in terms of risk and investment to reduce that risk. So let's say you have $1 million and you're going to spend it improving public transportation in an area. Let's say you're buying new buses. So each person in that population should get some measure of the benefit from that investment. People can get to where they need faster. Maybe people can ditch their cars for buses because it's more convenient. But if you take the time to identify the people that really need transportation solutions within that population, say accessible transport, then your investment could fall proportionally towards the people that need it more. So these people can say, get to the doctor's office more often, which helps to identify conditions that could lead to expensive hospitalizations. So that's just one way of thinking about sort of macro versus micro.
So when you talk about aging, how do the social determinants of health impact us as we age?
Well, macro level things like quality of schools in an area can impact us when we're younger and of course when we're parents. But more universally, micro-social determinants will certainly impact us more and more as we age into our Medicare years, age 65 and older.
Why is that, Mike?
Well, as we age, we tend to experience changes that limit our ability to do our day-to-day tasks and generally get around. I mean, everyone's different, but we're all going to face change, whether it's clinical, cognitive, function, or, a combination of all.
So you mentioned function. I was curious, how do you define function?
Yeah, in general, function measures our ability to live independently. So when we see home health or home care support services, come into the picture, it's very often because the person receiving the care lacks the functional ability to do things on their own. It's generally categorized into two types. One is called ADLs, or activities of daily living, and the other is called IADLs, called instrumental activities of daily living. ADLs are things like walking, dressing, climbing stairs, bathing, and IADLs are things like making meals, paying bills, shopping, and driving. So when a home care agency, say, draws up a plan of care for someone, they'll look at each of those ADL, IADL categories and say, this person can do this, let's say it's bathing, can do independently, or needs some assistance, or needs total assistance. And in fact, this is something that most of us is going to, sorry, I'm falling over my words here. This is something that most of us are going to face in the future. U.S. Department of Health and Human Services actually estimates that 2/3 of us are going to need help with day-to-day tasks at some point in our lives.
Oh man, that's something I don't think anyone really wants to think about, right?
Yeah, I know. But it's something that we have to recognize and prepare for, both to reduce our potential need for these services and to use them smartly when we are at need. And it's all about maintaining a lifestyle that's healthy for you and making common sense adjustments to our environment and behaviors as we age. And it's also about engaging our families and making sure that they're educated about how to care for you when you're at need. And it's really important because if care is not properly delivered or arranged, then your risk of trips and falls and negative health events can increase, which can lead to more rapid declines, and with it, the need for outside care, including nursing care. In fact, I once heard someone say that, if somebody's tripping on the edge of a rug that's been in the house in the same spot for 40 years, what's changed?
Thanks, Mike. We really appreciate you sharing those thoughts with us. And to continue the conversation, please feel free to reach out to me or Mike directly.